The role on MRD in diffuse large B-cell lymphoma is something new, but it's something that is emerging in the last few years. And I think there is a really very good potential role in the future, because when we assess the response rate in diffuse large B-cell lymphoma, we are used to base on PET results, and patients who achieved a complete metabolic response with PET a good prognosis, a better prognosis compared to patients who did not achieve complete metabolic response. Minimal residual disease with circulating DNA can provide additional information, probably different information, because in the clinical studies so far, we have some patients that are PET negative but are still MRD positive, and this may explain also the relapse rate also for PET negative patient. And so MRD seems to be more sensitive because it's traditional imaging. And the other potential use is just to monitor earlier in the course of the treatment the response for diffuse large B-cell lymphoma. There are some studies, including recently the POLARIX study, that is the polar chip randomized versus standard CHOP, in which MRD was assessed very early after the first courses of chemoimmunotherapy, and the patient who achieved MRD negativity had a better outcome compared to patients who remain MRD positivity at an earlier stage. So in the future, this could be a useful tool just to monitoring the response of the patient early, and maybe to decide to shift the patient to a different strategy. There are some caveats, because so far there are many technologies that we can use for MRD detection, and of course it's not something that we do in clinical studies, so we have to harmonize the technologies before jumping in clinical practice.